Well, good afternoon, everybody. My name's Neil Griffiths. I'm the soon-to-be managing director of an organisation called Teletracking, who I'll tell you about in a moment, but I'm currently the Deputy Chief Executive at UCLH. I finished there on the 11th of August, to start with Teletracking on the 14th of August. I've been leading for the last 3 years UCLH's transformation programme, hence why I've decided to move to Teletracking. They're a very credible organisation based in the US, but doing an increasing amount of work in the UK, really partnering with hospitals to transform operational processes around patient flow, patient pathways, real-time tracking of performance, and we've been quite blown away with what they've been doing in the US and increasingly what the potential can be in the UK. Now, it is technology, but actually the technology is brought together with change management, lean management, approaches to actually how you change culture. So there's doing a sort of people, process, technology piece. That is the holistic thing as to what the organisation it's all about. It's privately owned, and they are really mission-driven around actually eliminating waste in hospitals, weights, and actually how you can tackle things through actually just seeing performance in a transparent fashion, so you can actually start to continuously improve and tackle where you need to focus your efforts. So really their mission is to eradicate waste in healthcare and hospitals. 40 seconds, slightly less now because I'm a bit behind, on why we need to change. We know the NHS is under increasing pressure, and I fundamentally think that actually the way hospitals work operationally needs to change and shift, because actually doing it piecemeal year on year is getting harder and harder and harder, and I think what Teletracking can be really transformational. I think also as leaders we need to provide our frontline staff with tools and techniques to work in a slightly different way so they're less frustrated on a day-to-day basis. At UCLH, we did a piece of work that estimated a third of our clinicians' time is wasted on broken processes and technology that doesn't work. So transformation, I think, is why this technology can work, because it needs to be, in the longer term, seen as time-based in terms of the persistence to make it happen. It can't be just technology for technology's sake. Actually, at UCLH, our experience has been that actually you need to really think about it in the long term. So what we've done and what Teletracking model is all about is actually setting up a coordination centre which becomes the hub of your hospital operational performance, where you can see in real time what's going on across your whole system in a way that you can't currently, because it's mostly based on bed managers running around with flip charts. You can imagine a room like this. They do exist in the US and increasingly need to exist here, where you can actually see everything that's going on in your hospital. These rooms are completely silent, but you can communicate across the whole of your trust about what's happening, whether it be in ED, theatres, what your porters are doing, how delayed your beds are, and actually how the hospital needs to track and improve its performance. At UCLH, we were so daunted by this to start with, we decided to work created our own wheel of reach where we would increase the impact of this over time by working outwards and effectively standardising our operational processes across the whole trust. That's like a 5-year piece of work. The data here you'll see is seen across the trust in each department, so that every member of clinical staff can see what's going on. And where you talk to people, particularly in the US, but increasingly in the UK, they cannot do without this information to the way they manage their hospital at the moment. So we think this really is fundamentally different to how hospitals need to work. So in terms of a new operational model for your hospital, with this data, you can start to drive into, on a continual basis, areas of performance that absolutely reducing waiting times and increasing your productivity by estimated between 10 and 20%. Now, all of you in this room will be working on various bits of this chart in terms of the areas of your focus. But actually, what this opportunity does through this platform is to look at the whole lot in one big piece. And we don't think anybody else is doing this. And actually, the benefits you can see from this, based on 870 hospitals performer, is quite significant, and it is deliverable. So David Lawton's in the audience here, so I'm about to talk about his trust. But Royal Wolverhampton have been doing this since 2013. Originally started through a clinical tracking of patients and staff for hand washing, but have been launching their coordination centre and have seen a significant improvement in their productivity. They've seen cancellations reduce. They've seen ED activities increase, but breaches have reduced. and overall average length of stay for their medical patients has reduced. So I think you're beginning to see the start of something quite significant. Now, the issue here is all because there is lots of data that is generated through this system, and there needs to be an ability to manage that data in a way which we haven't perhaps grasped at the moment. So it's very, very, very different. And I think the NHS improvement with Teletracking has started to dig into a pilot about how you can start to see this rolled out across a number of trusts so you can make the best use of this data. Now, in the US, they've been running these systems for a while, and most of them tend to use the technology not only to drive further performance improvement, as is outlined here, but also to make sure you can realise the benefits of working through lean, or how you can start to see your culture change embedded through the technology, and that is what is different about this approach in the UK. Now, most people do say, oh, a US hospital system is very different to the UK hospital system and you can't compare the two. I have to say, following a recent visit, we had a week over in the States. I think increasingly the challenge of US hospitals are very, very similar to UK institutions. So there is a lot of learning we can make from our US partners through this model. So I'm going to finish. I think I'm coming to my last slide. This is about whole hospital effort of transformation. If you're really interested in potentially engaging with this technology, joining a pilot potentially through NHS improvement with teletracking, please reach out to me, because I think this could be really significant in terms of the future for how hospitals need to operate in the UK.